Hello and welcome. Today we're diving deep into a complex and sight-threatening condition called Ischemic Optic Neuropathy or ION. We'll explore what causes it, how it damages vision, who's most at risk, and what we can do about it. Join us as we unravel the mysteries of IO and shed light on its impact on visual health. So, what exactly causes ischemic optic neuropathy? The root of the problem lies in insufficient blood flow to the optic nerve. Think of the optic nerve as a vital cable transmitting visual information from your eye to your brain. If this cable doesn't get enough oxygen and nutrients, it can become damaged. Several factors can contribute to this reduced blood flow. These include conditions like high blood pressure, diabetes, high cholesterol, and certain blood clotting disorders. In some cases, especially in anterior ischemic optic neuropathy or AIN, there may be anatomical variations or systemic conditions like giant cell arteritis that further compromise the blood supply to the optic nerve head. Now, let's delve into the pathophysiology, or how ION actually damages the optic nerve. The reduced blood flow, or ischemia, leads to a lack of oxygen, a condition known as hypoxia, and a shortage of essential nutrients for the optic nerve fibers. This triggers a cascade of events. Cells begin to malfunction, swelling occurs in the optic nerve head, and ultimately, the nerve fibers can become damaged and die. This damage is often irreversible, leading to permanent vision loss. The location and extent of the damage dictate the severity of the visual impairment. Who is at risk of developing ischemic optic neuropathy? Epidemiological studies have identified certain groups of people who are more susceptible. Individuals over the age of 50 are at a higher risk, with the incidence increasing with age. People with pre-existing vascular risk factors, such as hypertension, diabetes, hyperlipidemia, and sleep apnea, are also at increased risk. Certain ethnicities, like Caucasians, may also be more prone to developing the condition. It's important to remember that these are risk factors, not guarantees. An IO can occur in individuals without any apparent risk factors. What are the signs and symptoms of ischemic optic neuropathy? The hallmark symptom is sudden, painless vision loss in one eye. This vision loss can range from mild blurring to significant reduction in visual acuity. Patients often describe a visual field defect, which is a blind spot or area of reduced vision. This defect is commonly altitudinal, meaning it affects the upper or lower half of the visual field. Other symptoms may include decreased color vision, and in some cases, fleeting episodes of vision loss before the onset of permanent damage. It's crucial to seek immediate medical attention if you experience any of these symptoms. How is ischemic optic neuropathy diagnosed? Diagnosis typically involves a comprehensive eye exam by an ophthalmologist or neuro-ophthalmologist. This includes checking visual acuity, visual fields, pupillary reactions, and color vision. The doctor will also perform a dilated fundus examination to directly visualize the optic nerve head and look for signs of swelling or pallor. Additional diagnostic tests may include optical coherence tomography, or OCT, which provides detailed images of the optic nerve fibers. Blood tests, including erythrocyte sedimentation rate (ESR) and C-reactive protein (CRP) levels, are often ordered to rule out giant cell arteritis, especially in older patients. Ischemic optic neuropathy is generally classified into two main types: anterior ischemic optic neuropathy, or AION, and posterior ischemic optic neuropathy, or PON. AION is the more common type and involves damage to the optic nerve head, which is the visible portion of the optic nerve inside the eye. PO, on the other hand, involves damage to the optic nerve behind the eye, making it more challenging to diagnose. Within AION, there are further sub-classifications, including arteritic AION, which is caused by inflammation of the arteries supplying the optic nerve, and non-arteritic AION, which is caused by other factors such as vascular risk factors. Unfortunately, there is no proven cure for ischemic optic neuropathy. Treatment focuses on managing underlying risk factors and preventing further vision loss. This often involves controlling blood pressure, managing diabetes, lowering cholesterol, and addressing any blood clotting disorders. In cases of arteritic ION, prompt treatment with high-dose corticosteroids is crucial to reduce inflammation and prevent vision loss in the other eye. Low vision aids and rehabilitation can help patients adapt to their vision loss and maximize their remaining sight. While there's no guaranteed way to prevent ischemic optic neuropathy, managing your overall health and controlling vascular risk factors can significantly reduce your risk. This includes maintaining a healthy weight, eating a balanced diet, exercising regularly, and avoiding smoking. Regular eye exams are also essential, especially if you have any risk factors for ION. Early detection and management of underlying conditions can help protect your vision. The prognosis for ischemic optic neuropathy varies depending on the individual and the severity of the condition. While some patients experience stable vision loss, others may experience further deterioration over time. Unfortunately, vision rarely improves significantly. However, ongoing research is exploring potential new treatments, including neuroprotective agents and gene therapies, aimed at preventing further damage and potentially even restoring vision. While these therapies are still in the experimental stages, they offer hope for the future. The information provided here is intended for educational purposes only and should not be considered medical advice. Always consult with your doctor or other qualified healthcare professional for any questions you may have about a medical condition or treatment.